Welcome back to the channel, where we decode the latest in rheumatology and immunology so you don't have to. Today we're diving into a hot topic from ACR Convergence 2024. Can cytokines like IL-18 help us predict who develops long COVID after infection, especially among patients with systemic autoimmune rheumatic diseases, or SARDs? Let's get into it. Even as acute COVID-19 cases decline, many people, especially those with autoimmune diseases, are still struggling with long COVID or symptoms that persist for 28 days or more after infection. For patients with SARDs like rheumatoid arthritis, lupus, and vasculitis, this isn't just frustrating, it's debilitating. These patients already have immune dysregulation and chronic inflammation, and they're often on immunosuppressive medications, which makes things even more complicated. To better understand what's going on, researchers from Harvard, Brigham and Women's Hospital, and Massachusetts General Hospital conducted a prospective study using data from the RheumCARD initiative. They enrolled 201 patients with SARDs who had confirmed COVID-19 and were at least 28 days post-infection. Each participant completed detailed symptom surveys and provided blood samples between March 2021 and July 2023. The lab team used the Olink Target 48 inflammation panel to measure a wide array of cytokines. Importantly, they excluded results from patients on medications that directly suppress a given cytokine, such as anti-TNF agents, to avoid skewing the results. Here's the key finding. Patients who developed long COVID had significantly lower levels of IL-18, a pro-inflammatory cytokine that drives cell-mediated immunity. The average IL-18 level was 199 units in long COVID patients, compared to 221 units in those without persistent symptoms. This association remains statistically significant even after adjusting for confounding variables. Other cytokines like IL-2, CSF2, and CCL6 also showed associations, but IL-18 stood out as the most consistent marker. And this wasn't a one-off result. The association held true across different COVID variant eras, including pre-Omicron and Omicron periods, across different levels of autoimmune disease activity, and even when long COVID was defined more strictly as symptoms lasting 90 days or more. So what's the immunologic significance of IL-18? IL-18 is a pro-inflammatory cytokine that activates natural killer cells and Th1-CD4+ T cells, promoting the release of interferon gamma. These immune responses are essential for effective viral clearance. Lower IL-18 levels may indicate a blunted or insufficient immune response, potentially preventing patients from fully eliminating the virus or resolving inflammation after infection. This challenges the usual narrative of long COVID being a result of excessive inflammation. In patients with SARDs, it may instead reflect immune insufficiency or dysfunction. So, what does this mean for clinical care? First, IL-18 may serve as a predictive biomarker, allowing us to identify patients at risk for long COVID early in their recovery. Second, treatment strategies might need to shift from suppressing inflammation to supporting or restoring immune function. Third, even patients with mild autoimmune disease or those in clinical remission may still be vulnerable, which suggests we may need standardized post-infection monitoring. And finally, this opens up new research directions into immune reconstitution, T-cell-based therapies, and possibly even the therapeutic use of interferon gamma in select long COVID cases. So the next time you think about long COVID, remember, it may not be all about the cytokine storm. In some cases, it's the quiet immune system that causes the longest echoes. If you found this video helpful, make sure to like, subscribe, and drop a comment if you want us to cover more immunology deep dives or other ACR 2024 highlights.